We have a wonderful guest today who's actually going to be with us this month and next month. May I introduce to you Ms. Maddie Verna. She is a fabulous cardiac telemetry nurse at MedStar Washington Hospital Center. She is working on her master's in nursing education at Penn State. Part of what she needs to do to get her master's, so we're helping someone today. She is going to give us some education presentations. This is very important, so I am going to hand it over to Maddie. Take it away.
All right, great. Like Amy said, I am a cardiac nurse, currently working at Washington Hospital Center, and I'm excited to share this topic with you today. So give me a moment. I'm just going to share my screen. So as is mentioned, today we're going to be talking a little bit about cardiac warning signs. I'm going to go through a little presentation, and then there's going to be a time for question and answer if anybody has any questions at the end that I'd be happy to talk about. But first I want to talk a little bit about why this is important. So I think Amy already spoke a little bit to it, but being able to pick up on the signals your body gives you can help guide you to seek appropriate care and medical attention in a timely fashion, especially with a couple of the conditions we're going to talk about today. Some of the conditions have signs and symptoms that may look different from men to women. It may look different for people who have different things in their medical histories. So it's important that we kind of have this general awareness of what these symptoms are, and then also a more specific awareness of maybe how this could differ depending on your gender or other factors in your medical background. So that's why this is a really important topic. A couple of things we're going to be covering and going over today. The first thing, we're going to be discussing the signs and symptoms of a heart attack, again, with special attention paid to populations who might experience these symptoms differently. We're going to be talking a little bit about strokes today as well. You might think, okay, we talked about cardiac warning signs. Why in the world are we talking about the brain? But really, in all honesty, a lot of the risk factors that put people at risk for having heart attacks are the same exact that put people at risk for having a stroke. So that's kind of why I'd chosen to include stroke in what we're talking about today. And then the last thing we're going to talk about is identifying notable signs and symptoms in heart failure management that can indicate a change in your condition for which you should notify your healthcare provider. Because heart failure is a lot about long-term management and making sure that you know your body and you know what your body's telling you. So that's what we're going to go over today. All right. So the first thing I wanted to talk about was just the basics of what a heart attack is. And I know it's possible because we're in a cardiac support group that maybe a couple of you have experience with this or have a friend or a family member who may have had a heart attack in the past, but at its most basic form, heart attack is basically damage to the heart muscle that's caused by a lack of blood flow through the coronary arteries. And as you can see on the picture that's on the right-hand side of the screen, the coronary arteries are the blood vessels that line the outside of the heart. And what we see on the outside of the heart actually is really just the big ones. There's this whole network of tiny little blood vessels that go into the heart tissue and feed it. And oftentimes when we think about, a heart attack, this lack of blood flow can be caused by a fatty deposit or a plaque. And that's what's depicted on kind of that zoomed in portion of the picture there. That plaque is caused by over time buildup of fatty deposits, of calcium, of things that basically because of irritation in the inside of the blood vessel, there's blockages kind of started to form. So that's usually over a long period of time, or this can also be caused by blood clot. And sometimes that can be just because something is dislodged elsewhere, and that can be kind of like a much more sudden thing. So regardless of what causes the blockage, the main issue in a heart attack is that heart muscle is no longer getting oxygen because oxygen is delivered by the blood. And that causes a problem because our heart muscle cells need oxygen and need blood to survive. So that's why the warning signs that we're going to talk about in a little bit are ways that your body is telling you, hey, this heart muscle, it's not getting oxygen, it's not getting what it needs. There's something we need to do about this. So that's basically what's happening when someone has a heart attack. So first I want to talk a little bit about typical heart attack symptoms. And typical, everybody pretty much almost universally, it's well known that chest pain is a heart attack symptom. And a lot of people who do have heart attacks have chest pain. This chest pain is typically described as a pressure, a tightness, or a squeezing. And then this pain not only is just in the chest, but it also can what's called radiate or spread through the chest to other areas of the body. And this can include the upper abdomen, it can include the shoulders, the arms, the neck and throat, or the lower jaw and the teeth. And I'm going to have a visual on the next slide that shows a little bit more kind of where those areas are. And then another characteristic of the cardiac chest pain is that pain comes on gradually and it lasts more than a few seconds. So usually it's something that's sustained, it might last a few minutes and then go away, or it might be sustained over a long period of time. And then in medical training, so when you go to medical school or nursing school, they kind of tell you to recognize this thing called Levine sign. And that's what's depicted in the picture on the right. It's basically if a person comes in and they're kind of squeezing their hand over their chest and holding it right there. That's kind of like this universal sign, kind of like the universal choking sign where people will hold their arms up to their throat. That'll tell you that they're choking. Levine sign is one thing that they recognize, that when people are having heart attacks and they clench their fist over their chest, that's kind of something that can alert us to the fact that, you know, this pain is squeezing, it's tight, and that would make us think that maybe this person's having a heart attack. So that's what there is to know about chest pain. The one thing I want to talk about though is the location of the chest pain, because a lot of times I think we think of chest pain as, okay, like the center of the chest, the upper chest, which the first photo shows, sure, it might be. But a lot of time chest pain can kind of radiate to spots or go to spots that weren't necessarily as going to associate with the heart. So these pictures, the red spots kind of depict all the different spots that cardiac chest pain can take place. And I'll say one just particular spot that I want us to pay attention to, because I have had so many patients come in, is this like what's called epigastric chest pain. So kind of like in the area of like you've ever had heartburn, kind of like right above your stomach, right below your breastbone, would be this epigastric pain. And I can't tell you how many people I've known who've come in and they said, I thought it was just indigestion. You know, I thought it just didn't go away after a long time, but like I took a Tums, like still didn't go away, but it actually turned out that it was like cardiac chest pain. So it's important to know that when you have a heart attack, it might not only be just in the upper chest, but it can feel like heartburn. It can go specifically to like the left shoulder, down the left arm. It can go down both arms. Or in some cases, it can even go, when the last picture on the bottom right shows, is kind of more of like a back pain between your shoulder blades. That's what intrascapular means. So point being, there are a lot of different patterns that cardiac chest pain can present, but that squeezing, the lasting for more than a few seconds, is consistent between all of these. So any pain that is in any of those places that you would associate with those characteristics would be concerning for the chest pain associated with a heart attack. But it's important to know that it's not just necessarily in the upper chest. Other than just chest pain, which I think we think of as the most typical heart attack symptom, there are other heart attack symptoms as well. These can include shortness of breath, nausea, vomiting or belching, sweating when it's even not hot out, palpitations, which basically just mean like skipped heartbeats, lightheadedness, feeling tired, or even fainting or passing out. And what's important to know about these other heart attack symptoms is that there's really a difference in who experiences these between men and women. So you can see on the left hand of the slide, there's a picture of a man. Men are more prone to have chest pain. That pain that radiates to other places we were just talking about, shortness of breath, and nausea or vomiting. So when we think about the more classic signs of a heart attack, that's what men are more likely to have. Not all men will have these, but men are more likely to have them. Whereas women are more likely to possibly have those, but also lightheadedness, extreme fatigue, indigestion, or fainting are more common heart attack symptoms in women. And being that it was just Women's Heart Month last month, these are things that are really important to pay attention to, because heart disease affects women. It's actually the #1 cause of death in women in the US. So it's important that we kind of pay attention to these symptoms, because women, especially after menopause, the changes in our bodies with hormones can affect the way that our arteries kind of develop, and we can develop those plaques more easily because of changes in the hormones that are in our bodies. So these heart attack signs, even though they're not necessarily the chest pain, shortness of breath, nausea and vomiting that are most likely going to be experienced by men. I've had women come in and say, I've just been really tired all week, and it turned out they were having a heart attack. So sometimes women, we can unfortunately present and go to the doctor with things that aren't necessarily considered as classic of heart attack signs, but there's still things that we should pay attention to. Really, for women, if we have any change or, this just feels funny and I don't feel right about it, it can never hurt to just ask for advice and talk to your medical provider or a doctor if just something, doesn't feel right, hasn't gone away. It's never a bad idea just to ask. So that's kind of what I wanted to talk about with that. The last group of people that I really wanted to address is for people with diabetes. A lot of times, especially in the United States, diabetes is relatively common, and it can actually make people more likely to have a condition called silent ischemia. Ischemia is basically the fancy medical term for what we were talking about on that first slide about the basics of what a heart attack is. It's just a lack of oxygen to the heart muscle. The way that diabetes affects the body is that it increases the risk of coronary artery disease. So those plaques building up in the arteries surrounding the heart. So we know that those two are kind of tied together. And also this thing called silent ischemia. So as opposed to all the symptoms that we just discussed on the last couple slides, it's possible that someone with diabetes can have a heart attack and experience none of them. And this is because differences in the pain receptors in the heart and the way that pain is perceived by the brain contribute to this kind of lack of ability to feel chest pain because of the way that diabetes contributes to the way that nerves conduct their signals in our body. So really what there is to know about this is that if for whatever reason a doctor would suspect that, there might be a heart problem in someone who has diabetes, they may have to do a lot of testing as opposed to someone who has a heart attack and comes into the emergency room with this crushing chest pain. It can be a lot easier to be, oh, that person's probably at risk for having a heart attack. Whereas someone who's experiencing this silent ischemia, it can be more difficult to catch. So it may take more testing and it may be more difficult for the doctor to kind of determine what exactly is going on because the symptoms aren't necessarily descriptive of having a heart attack. So just something to keep in mind. And it's always good when you see like a new doctor or someone that you haven't seen before, just to make sure that you tell them, everything that's in your medical history. That way they can be most aware of everything that's going on in your condition, and they can kind of keep these sort of things in mind that in diabetes, that there is a chance that possibly someone could have this lack of oxygen to the heart muscle and not experience any symptoms because of it. So with this though, the most important thing in all of it is that time is heart muscle. And so if there are symptoms, especially chest pain, that's new, severe, prolonged, or honestly just causing you concern, you want to call 911 and seek medical attention immediately because if it actually is a heart attack, the sooner that they restore the blood flow to the heart muscle, the less damage that will be caused by it. So time is of the essence. If any of these things are things that you're experiencing, it's always best just to get evaluated, have them take a look at you and make sure everything's okay. So that is all I've got to say about the signs and symptoms of a heart attack. We're going to switch gears here real quick and talk a little bit about a stroke. So like I said, this isn't necessarily like a heart condition, it's more of like a thing to do with the brain. But a lot of heart conditions put people at risk for having a stroke. And strokes, just like we talked about with time is heart muscle, time is also brain. So recognizing this quickly and making sure that you're kind of taking into account the signals that the body is sending is important for making sure that you kind of decrease the amount of time until they can have treatment, because the more time goes by, the more risk of like long-term neurological damage. So we're going to go back to the basics here as well and talk a little bit about what the basic of what a stroke is. So just like we talked about with a heart attack, that it was lack of blood flow to the heart, in a stroke, very similar, it's lack of blood flow to the brain, and it causes damage to the brain cells. Now, there are two major causes of stroke. One of them is called ischemic stroke, so that same fancy medical word that we just talked about a little bit ago, that is lack of blood flow, that's caused by a blockage. And then there's another type of stroke called a hemorrhagic stroke that is caused by bleeding. So just a little bit of context on what heart disease puts people at risk for these sort of things. Heart disease, specifically coronary artery disease, is a risk factor for an ischemic stroke because the blood vessels in the heart and the brain are both affected by the same disease process with the buildup of plaque and the blockages. And then heart rhythm problems, such as atrial fibrillation, can increase the risk of an ischemic stroke because of blood clots that form inside the heart and travel to the brain. So both of those can cause a blockage. The one that is more likely to cause bleeding is high blood pressure or hypertension. So if someone has very, very high blood pressure, it can possibly cause this type of stroke associated with bleeding. The slide on stroke symptoms is relatively short because there has been this mnemonic device that has been created that makes it super easy to remember stroke symptoms. So the mnemonic is be fast. So each of the letters, except for T, stands for something that is a sign or a symptom of a stroke. So whether this is you or someone that you know is experiencing any of these. I'm also going to talk a little bit about if you're kind of with someone else who you think is having a stroke, how to kind of determine whether some of these signs and symptoms might be concerning. So the first one is B for balance. So if someone has a loss of balance, like if they're walking and just kind of really can't regain their balance, if they have a headache, or if they're very dizzy, that can be all signs of stroke. E for eyes. If there is a sudden loss of vision in one or both eyes, and it doesn't have to be a complete loss of vision either. Sometimes it can be loss of what we call part of the visual field. So maybe someone won't be able to see anything to the right side of their body or anything to the left side of their body, or maybe even just like a little bit. So if you're trying to figure this, someone else said, my vision just seems weird. You can kind of take one of your fingers and say like, okay, like move it in front of their face and say, when can you see my hand? And people generally should, with their peripheral vision, should be able to see it about like the side of their face by their ear. But if it takes until it's like right in front of them and they're like, oh, now I see it, or if they're not following your finger at all, that can be concerning that they're having some of these visual loss. The next one, F for face. So does the person's face look uneven? The best way to tell this is to ask them to do a couple of movements with their face that'll kind of make it a little more obvious. So you can ask them to smile. And so normally when we smile, both corners of our mouth go up at the sides. But if one of them lags behind or doesn't move at all, then that is what we call a facial droop, which would be caused by the brain not telling that side of the person's face to move. You can also ask them to puff out their cheeks and put air in them. And if they can't puff out one side of their face, that would also be an indication to you that maybe they're having some problems with unevenness in their face. The A stands for arm. So this basically is referring to weakness. So if you tell a person, okay, raise your arms out in front of you and hold them straight, typically we like to have them hold them there for like 5 seconds or so. But if you notice, one of their arms starts to drift off or they're unable to lift one of their arms at all, then that would be something that would be really concerning for a stroke. Finally, the final symptom that we'll talk about is the S for speech. And so if someone's having difficulty speaking, either they just can't get words out, or I've had people who they've come and there's like almost like a fake word that they make up when they like can't say, like when their brain can't find the word necessarily to say. Slurred speech is another indication of a stroke. So if someone just really can't get their words out very clearly, or it's possible as well that the speech impairment could be complete, that someone may not be able to speak at all. And that can be really frustrating for someone. So any of these symptoms are symptoms that are concerning for a stroke. And so the last letter in this acronym is T for time. So A, if any of this is happening, you want to get emergency services to you or someone you love as soon as possible. And then the whole acronym Be Fast then kind of comes into play and makes sense because you want to get people there as fast as possible so they can help them. And that leads into the next slide here, which I've already mentioned a little bit, but just like we talked about, time is heart muscle, time is also brain. So if you or someone you know is experiencing these symptoms, you want to call 911 and seek emergency medical assistance. And then if you're calling for a friend or a family member, it's helpful to know the last time you saw the person normal, meaning in their normal state of health. So if that was like an hour ago, or you saw the change happen before your eyes, that's important for doctors to know so they can decide what treatments they give them, because the amount of time from when they were last known normal is what we call it until they reach the hospital is going to determine whether they can give treatment or whether they'll have to watch them or what. So it's really important to seek treatment as soon as possible if you notice any of these things. All right, we're going to flip gears for the last time here then to heart failure. I know this is a lot of information, so thank you all for staying with, but we're going to talk a little bit about heart failure as well. So heart failure occurs when the heart can't pump blood as well as it should. And there are two major types of heart failure. What we call heart failure with a reduced ejection fraction, where the heart is too weak. That's depicted on the picture on the right, where the heart muscle is really thin, and so it has trouble squeezing and pushing the blood out. And then there's also something called heart failure with preserved ejection fraction. And that basically just means that the heart is too stiff. So the heart can squeeze the blood out just fine, but it has trouble filling with the correct amount of blood, so that the blood getting to the rest of the body is still not enough for the body to have enough blood flow and for all the rest of the organs to get the blood and the oxygen that they need. So a couple of things can cause heart failure in the major categories of, so high blood pressure puts stress on the heart, and that can eventually cause the heart to become weak. Coronary artery disease, so like we were talking about, the more time that goes by after a heart attack, or the bigger an area affected by a heart attack, can cause damage to the heart tissue, the heart muscle. So sometimes after someone has a big heart attack, the muscle can't recover as well as it should, and heart failure can result because of that. And the next one, cardiomyopathy, is oftentimes caused by like a genetic condition, so or like an autoimmune condition. So if someone has a family history of heart failure, or multiple people in their family have had issues with heart failure, a lot of time it can possibly be due to what's called a cardiomyopathy. And then the last thing that can cause heart failure is heart valve disease. So if the valves in the heart that are supposed to open and close when the heart beats and rests don't do that properly, then that can increase the pressure on the heart and cause more strain for it as well. So that is basically what's happening in heart failure. What is different about heart failure really than the last two things we talked about is that heart attack and stroke are things that happen acutely. So meaning that they happen kind of all at once, and it's important to get to the emergency room as soon as possible to be treated. Whereas heart failure can be something that can kind of build up over time. There can be what's called exacerbations of heart failure, where heart failure is made worse, and that can be an emergency. But a lot of times heart failure management is more just knowing your body and knowing what you normally feel like, and paying attention to kind of when things change, so you can add it, like loop in your medical team if they need to know something. So that's more what the focus of this section is going to be about. So first, I want to talk a little bit about just kind of generally what symptoms are experienced with people who have heart failure. So those symptoms can include shortness of breath, and specifically shortness of breath that requires someone to cut back on their activities. So if someone normally, say, went on like a 2-mile walk every day, and all of a sudden they find it difficult to walk more than just down their block, or if they're used to doing household chores every day and then they find it difficult to just fold a load of laundry, that is kind of the cutting back on activities that is described here. And then shortness of breath that would also require you to sleep on several pillows to elevate your head. And the reason for that is that when people lie flat, if there's extra fluid on the body, that can increase the pressure on the lungs and increase the fluid on the lungs. So a lot of time for people with heart failure, it's more comfortable to sleep on a couple pillows at night rather than just one. Other symptoms can include feeling tired or fatigued quickly, weakness, particularly in your legs when you exercise, dizziness or lightheadedness, a fast heart rate even when resting, and then also swelling in the lower legs and the feet, which we call edema, or in the belly and the abdomen, which is called ascites. And then the last symptom here, unintentional weight loss, is usually not seen except in severe heart failure. More typically, people who are kind of on this journey of chronic heart failure will have unintentional weight gain, which we'll talk about in a little bit. But weight loss can also be associated with heart failure. So the next couple of slides here come from a tool that talks about daily management of heart failure. So like I said, it's really important that if you're someone who has heart failure, that you're paying attention to your condition. And so what this tool recommends is that every morning when you get up, you want to check for 4 things. So 2 of them are on this slide and 2 of them are on the next slide. So the first thing is you want to check for changes in breathing. So can I breathe as well as I usually can? Do I get out of breath doing things that I normally can do without a problem? Am I coughing more than usual? And then also thinking about with that shortness of breath while sleeping, did I use more pillows than usual to sleep last night? So all those can kind of clue you in to changes in your breathing. The second part is changes in weight. So one really important thing in heart failure management is taking a daily weight. It's important that that's done consistently. At the same time, so this tool recommends that you weigh yourself every morning after urinating, but before eating, and then write down your weight on a calendar. And that kind of helps you keep track of, what's the change in this week? What's the change from yesterday? And then those are the questions that it's asking. Has my weight gone up or down since yesterday? And if so, by how much? And then comparing it as well to a couple weeks ago. And if so, by how much? And with heart failure, we're not necessarily talking about changes in weight that are due to gain or loss of fat. It's more or less gain or loss of water weight. Because when the heart can't pump it as efficiently, it has issues moving fluid around. So more likely people with heart failure are going to have changes in weight due to retaining fluid or keeping fluid on their body than it would have to do with like fat tissue, like we normally think about changes in weight. The next thing that you want to pay attention to every day is with swelling. So looking, excuse me, at your ankles. Are they more swollen than usual? Do your socks or shoes feel tighter? Do clothes feel tighter at the waist? And then if you wear rings, do they fit more snugly? So taking a look, because worsening swelling can be part of that increase in water weight. And then also changes in your ability to do everyday things. So can I do everything that I normally can do, such as get dressed on my own, make meals, or go for walks? And then do I feel more dizzy or tired than usual? Do I have any new symptoms like pressure or pain in my chest? Does my heartbeat feel strange or irregular? And then do I feel like I might pass out? So these questions are kind of meant to be used every day, kind of as a test to see, okay, how am I doing today at baseline? Does it feel different than yesterday? Do I feel better or worse? And then the next couple slides are going to take us into a decision-making tool to figure out what you should do if any of these changes are to take place. So this tool first has on the left side the symptoms, and then on the right side what the recommended action would be. So the first green one, basically, if there's nothing that's changed, is kind of what it's saying. So no trouble breathing, no chest pain, able to do your activities, everything's kind of how it usually is for you. Then your symptoms are under control. You want to keep, if your doctor has you on medication, you want to keep taking that. You want to keep weighing yourself daily and writing down your weight and keep going to your scheduled medical appointments. So everything is all well and good. There's really nothing else to be done other than the treatment plan that you and your doctor have already talked about. The next one in yellow. So things like if you need more pillows than usual to sleep, if you're noticing you're having more trouble breathing when you're active, and that could even just be like going on a walk active, doesn't have to be running a marathon. If you have more coughing than usual, if you've increased shortness of breath with activity, and then if you gain 2 to 3 pounds overnight or 5 pounds in 1 week and have more swelling than usual, then the recommendation is that it's possible that they may need to make adjustments to your medicine. So you should call your doctor's office to find out what you should do. So they would be able to give you advice in terms of what next steps will be, or maybe they want to see you for an appointment. But those are all things that, would be worth calling your doctor about, not necessarily in an urgent fashion, but just in a, make an appointment or follow up with them. The next section here in orange are things that are kind of getting a little more concerning that you would want to see a doctor for right away. So if you have trouble breathing when you're resting, or if you can't stop coughing, any wheezing or chest tightness when you're at rest. So the main difference here is that when the last column we were talking about being active, now we're talking about being at rest. If you wake up at night because you feel like you can't breathe well, if you feel dizzy, tired, or like you might fall, or if you gain or lose more than 5 pounds compared with your normal weight. So those are all things that this tool would recommend that you probably need to see a doctor right away. So you should call your doctor's office now to be able to figure out what the next steps should be. And then here in the red category, these are things that really would be indicators of what we call heart failure exacerbation. So we talked about how heart failure is more of this condition that you manage on a day-to-day basis, and doesn't really have, that emergent nature of a heart attack or stroke. But these things in this red column are things that would kind of be considered under that emergency status in heart failure. So if you have trouble breathing, that doesn't go better no matter what you do. If you feel like you can't breathe, or you're noticing that you are starting to turn blue, so you might see that like on your fingertips, especially in like your nail beds, kind of like a purpley dusky color can be concerning. If you cough up frothy or pink saliva, if you have pain or pressure in your chest or other signs of a heart attack, if you have a fast or uneven heartbeat that you won't go away and makes you feel dizzy or lightheaded, if you feel very confused, or if you faint, those are all things that are very serious and that you should call 911 for an ambulance to be brought to the hospital so they can take care of you and make sure that kind of everything becomes stable with heart failure. So basically, like I've been saying, paying close attention to your health is vital. So heart failure is a long-term condition. It requires you to pay close attention to changes in how you're feeling. So keeping the information from the previous slides in mind as you monitor your condition can be helpful. That way, kind of have a guide for what exactly you need to do, or what kind of symptoms might be concerning in heart failure. All right, I've talked for quite a while, so I'm going to stop sharing my screen. But if there are any questions or anybody who just has anything they're curious about, now's the time for question and answer.
Maddie, I have a couple questions. Just curious, when talking about ejection fraction, is that something we should expect that will decline as we age?
Yeah, that's a great question. So when we talk about ejection fraction, the definition of that, or kind of like what it is the amount of blood that the heart squeezes out with each beat. So our heart doesn't squeeze out 100% of the blood with each beat. No one's ejection fraction should be 100%. In fact, normally it's between 55% and 65% because the heart is still going to be filled with some blood at the end of each beat. So when we talk about like what exactly is normal versus what is heart failure, they don't even really start calling something heart failure until you get in the 40%, like 40 to 45%. Is kind of where they start to talk about heart failure. But regardless, in terms of like what should we expect as we age, that I don't know if like there's like a normal like age related change from like what your heart normally puts out. So I don't necessarily want to answer like and say, it goes down by this amount. But what I can say is that anytime we're thinking about heart failure, we know that it's like not a normal number. Heart failure certainly is something that becomes, like a lot of chronic diseases, becomes more common as people do age. But I don't know that it had change in your ejection fraction is something that is what would be considered like a normal part of aging.
That kind of goes along with my second question as well. So once you're in, or once you have heart failure, is that permanent? Or can you sort of regain your health and get out of heart failure?
Yeah, that's a great question. So when someone goes into heart failure, usually so it all depends kind of like on the cause and the reason for it. So if we think about a heart attack, a lot of times after someone has a heart attack, their heart is what we call like stunned. So it's like, oh my goodness, like everything has just happened, and it just has a little bit of an issue with like pumping and squeezing as well. There are certain medications and certain treatment that has been proven, like medications and lifestyle changes that can help someone regain as much of that heart function as possible. So in that way, yes, someone can get better from it. However, some of the other causes of heart failure, so when we talk about a lot of the cardiomyopathies and like the genetic conditions that cause heart failure, we can kind of optimize and make it as best possible for that person to live with their heart failure. But a lot of times in terms of like that disease process, not for every condition do we have something that can stop that. I know they're like working on some medications, but I know there are a couple of genetic conditions that I'm thinking about like specifically that we don't really have anything that will like reverse the underlying process of that. And for certain people, kind of depending on a lot of different factors, a lot of times that's when they would think about, you know, as if someone is progressing and getting worse from one of those conditions, maybe they would talk about like something more like the heart transplant realm, because like that person may not be able to get 100% better just because of the underlying cause of it. So
is heart failure more in women or men, or just about equal, or?
yeah, that's a good question. Honestly, that is not a statistic that I'm entirely sure of.
Okay.
Yeah, no, I would love to look it up though and get back to you guys on that.
All righty. Thank you.
Yeah.
I am losing weight considerably faster. Is it something to be concerned? I'm a heart patient.
Gotcha. Yeah, no, that's a fair question. So a lot of it would really be probably a conversation to have with your doctor, who would have like the more full picture of everything that's going on in your health. I will say though, a lot of times when we kind of look at people's weight and changes in it, any unintentional weight loss is always something that we want to think about in terms of, you know, is someone like, is it a nutritional issue? In heart failure, sometimes there can be a problem with blood getting to the stomach and your intestines, and them being able to absorb the nutrients as well. Sometimes when someone's having those sort of issues, though, kind of in severe heart failure, there will also be other indicators in their condition, kind of like the swelling and the breathing problems, like we were talking about. So really, without knowing kind of like everything, it's hard for me to say like whether to be exactly concerned about it or not. But what I would say is if you notice, you know, I'm losing weight rapidly, this is not intentional, I'm not trying to lose weight right now, that's a great thing to bring up with your doctor at your next appointment. Just because, you know, whenever it's not intentional, it's something that we kind of want to take into account, the whole picture. Yes.
Could you, I liked at the beginning, you did mention about the fact that like women, or sometimes even men too, don't have the usual symptoms, especially when it comes to having a heart attack per se. Can you talk a bit about the importance of being your own advocate?
Oh, absolutely. Yeah. So Amy's point is really important. Like I said, especially with Women's Heart Month being last month, it's really important because a lot of time, I mean, men and women both, but especially as women, there's a lot of documentation in like research that people have done that sometimes when women, we come to the emergency room, even with chest pain, we're more likely to be diagnosed with a mental health condition than with a cardiac condition. So for that reason, it's really important to be your own advocate. And one of the ways you can even be your own advocate is if it's possible to bring someone with you to the appointment, because a lot of time, either if you're in the emergency room or if you're at a doctor's appointment, there's so much information coming at you, and it can be hard to process both, you know, the emotions that are going on with receiving that information, as well as, you know, what questions should I ask, everything. So if you can have someone come with you to kind of validate, you know, say you've been feeling short of breath for a week, and, you know, you come to the emergency room because you just feel like the shortness of breath is really bad today. and you feel like you're getting dismissed, they're telling you you're just anxious, whatever, kind of having that second person there to say, you know what, this has been happening, I've noticed it. Because honestly, like even as a healthcare professional, sometimes I feel like when I go to the doctor, I'm like, no, like this has been happening, you know? And it's hard even for someone who's very familiar with the system. So having that second person there to advocate for you as well can really be helpful. But at the same time, if you feel like you're not being treated, your concerns aren't being addressed, definitely make that known, because like I said, these symptoms that are, you know, particular to being more common in women, like indigestion, like feeling very fatigued, are kind of these non-specific symptoms. And so a lot of time, you know, if someone walks into that situation and isn't necessarily quote unquote like looking for someone who's having a heart attack or looking for someone who's having something serious happen, that can kind of not always be at our front of mind. So definitely, if you feel like something's not right, advocate for yourself. Ask, you know, is there anything else that you guys would consider? Have you like taken a look at everything? Is everything else being rolled out? Just kind of knowing that, especially women, were more likely to be dismissed, unfortunately, but we're also more likely to have these symptoms that are kind of non-specific, especially when concerning cardiac problems. So I think Amy makes a great point that definitely take someone with you. And if you feel like you're not getting the answers that you need, you know, try again, because really it's your health at the end of the day. And it's, unfortunately, we can kind of feel like we're shuffled along in the system. I know even as a healthcare provider who's sometimes a patient, it can be frustrating to deal with this. So, but at the end of the day, my best advice is just like keeping a squeaky wheel, keep asking for stuff, and make sure that you feel like all your questions have been answered and all your concerns have been addressed before you leave, because that's the best way to make sure that you kind of advocate for yourself.
That's great advice, Maddie. I have a doctor friend who one day many years ago when we were at work, his wife called him and she was on the treadmill and I guess she was having some chest pain, and he's like, call 911. Call 911. No. She's like, if it's nothing, I'll be embarrassed. And he said something to her that has stuck with me forever. No one has ever died of embarrassment, but many people have died of a heart attack. So I'm so glad that I had you talk about that, and you did a great job of impressing upon that.
Yeah, no, I love that. That's what your friend said. That's so true.
Does climate have anything to do with it? Or could climate affect heart failure?
Definitely. Yeah, that's a great question. So we know that temperatures that are extremely cold or extremely hot can put up more stress on the body. And so anything that puts more stress on the body can increase the stress that someone has from heart failure, especially if their heart has to work more. So that's a lot of time when you'll see like on the news, and it's going to be, I feel like I'm going to talk about heat because DC is so hot in the summer. But I feel like we deal with more extreme heat, but you'll see like, for example, like the local news station will say, you know, today is going to be over like 90 degrees. We recommend for these specific population people to stay inside, stay somewhere cool. And the reason for that really is not just because we don't want to sweat so much, because you know, it's uncomfortable, but really like you're exactly right. There are implications in climate that definitely can make heart failure symptoms worse because of the increased stress that it puts in the body. So if you do happen to see, you know, on the news, they're saying it's going to be real hot out today, we recommend that people who have heart failure or, you know, different populations of people kind of stay in cold temperatures, stay inside, rest, hydrate. All of that they're saying is because the increased heat can put increased stress in your body.
Thank you.
Yeah.
Along those same lines, and I don't know if you can answer this, but there's always, you know, with the time change, there's always this sort of reporting of an increase in heart attacks and cardiac events. What causes that, or what is the thought behind that?
Yeah, so a lot of that is actually due to stress and changes in the body. So the Monday after spring forward is actually the most common day to have a heart attack on the calendar. Mondays in general are more likely for people to have heart attacks.
So that's
Um,
tomorrow. You're talking about tomorrow.
Yes,
Right.
I'm talking about tomorrow.
Just to clarify, okay.
Yes. But I mean, it's not necessarily just like the day of the week. Like the day of the week is kind of what's like universal for everybody because, you know, the stress of going back to work or heading back into the week. But heart attacks they're also more common after people go on like long travel, or, you know, the reason for that is really just because of the increased stress. I know I didn't talk about it very much in this presentation, but kind of managing our stress and managing our like stress levels is really important for keeping our health and keeping us healthy and well as well. It's not necessarily as part of kind of like overall wellness, but yeah, increased stress can contribute to a heart attack. And that is why the Monday after daylight savings is the most frequent day on the calendar to have heart attacks. Yeah.
Any other questions? Oh, go ahead, Norm. Go ahead.
I have one, Maddie, wonderful discussion and great presentation. Thank you so much.
Yeah.
You've touched a number of times on stress and controlling that. Silly but serious comment, as some of my friends know. I've been under a lot of stress lately, as a number of us have, trying to get the blankety blank taxes done. and we all have our different ways of coping with getting our taxes done and things like that. I have my stress reliever right here, which I'll show you. I'd love to hear what you do or what you recommend for getting rid of stress. And here's my stress reliever right here, who just came up to say hello.
Oh.
Unfortunately, she's nice, but unfortunately, she can't take care of the Form 1099s. What do we do this time of year?
Yeah, no, I mean, that's a great question. And I'm going to talk like more generally. So basically in stress management, you want to find like a healthy outlet that works for you, basically, because not the same thing is going to work for everybody. For me, I really enjoy physical activity and exercise. I like to run a lot, and be outside in nature whenever I can. But I hear from a lot of my friends that they hate running and they think, you know, it's like terrible and they don't enjoy it. So the point is it has to be something that you enjoy. So whether that is doing something like physical activity is a great stress reliever. It helps kind of release the adrenaline and all the stress hormones kind of you get out. And that can even be as simple as something like going on a walk around your neighborhood. If you enjoy biking, like whatever it is that you like to do. Granted, if you're going to start like a new exercise program or anything, and you know that you have a heart condition, it's probably best to talk to your doctor before starting that. I know we have someone here who is a cardiac yoga instructor, and so yoga is, I know, it's in your email signature. But regardless, like yoga, meditation, mindfulness are all great ways to reduce stress and kind of take some time to physically calm your body and your mind. And then just, you know, if there are activities that you enjoy, so like maybe that's spending time with family or spending time with friends, maybe that's reading, doing artwork, like anything that really helps get your mind calm and relaxed. Listening to music is great. So kind of whatever floats your boat, kind of within the reason of you kind of don't want to venture into things that would be harmful as well. So of course, you know, using things like drinking or anything like that to kind of take away stress is not usually super productive. So thinking about like healthy ways that you can kind of manage your stress is a really good thing. So, but different things work for different people. Those are kind of a wide array of suggestions, but really it's whatever works for you.
And if I could just chime in, but I was thinking, Maddie, when you offered your suggestions, I mean, part of picking something that you like to do, that means you are probably buying into the fact of doing it more frequently, right? You know, like if that's part of it, you want to set up a routine and be committed to it. So you want to pick something you like.
So that would wrap it up for today. Thank you, Maddie. That was a fabulous presentation, excellent discussion. And we do look forward to having you next month too. And